How are you?
Very good.
Good.
Can you see the screen?
Να αρχίσουμε τη διαδικασία. Αγαπητοί συνάδελφοι, κυρίες και κύριοι, εκ μέρους της Οργανωτικής Επιτροπής, με μεγάλη χαρά σας καλωσορίζουμε στο πρώτο συνέδριο υπερβαρικής οξυγονοθεραπείας στην Κύπρο. Η υπερβαρική ιατρική ή υπερβαρική οξυγονοθεραπεία, όπως είναι ευρύτερα γνωστή, έχει καθιερωθεί πλέον σαν μια μοντέρνα ιατρική πράξη, η οποία έρχεται αρρωγώς στην προσπάθεια αντιμετώπισης μιας σειράς δύσκολων ιατρικών και κυρίως χρόνιων περιστατικών από ένα μεγάλο φάσμα ιατρικών ειδικοτήτων, τα οποία έχουν σαν κοινό υπόβαθρο την υποξία, αρχίζοντας από την κλασική της εφαρμογή, που είναι η νόσος των δυτών και η εμβολία αέρα, και πηγαίνοντας σε πιο καθημερινές εφαρμογές, όπως είναι χρόνια τραύματα, ραδιονεκρόσεις, οστεομυελίτιδα, γάγκρενα και άλλες και πιο σύγχρονες στο στάδιο της έρευνας, όπως είναι τα εγκεφαλικά επεισόδια. Μεγάλη μελέτη που παρουσιάστηκε στο τελευταίο Πανευρωπαϊκό Συνέδριο Υπερβαρικής Ιατρικής κατέδειξε επαναφορά της πλαστικότητας του εγκεφάλου, ακόμη και μετά από πολλά χρόνια από το γεγονός. Επίσης η νόσος Alzheimer και η γεροντική άνοια. Στο σημείο αυτό θα ήθελα να ευχαριστήσω θερμά όλους όσους συνέβαλαν στην οργάνωση του συνεδρίου και ειδικά τους εκλεκτούς συναδέλφους από το εξωτερικό, οι οποίοι πρόθυμα ήρθαν για να μας ενημερώσουν αποδεχόμενοι την πρότασή μας και να μας μεταφέρουν τις γνώσεις τους. Σας εύχομαι καλή και επωφελή ακρόαση και θα ξεκινήσουμε μέσω Skype με τον καθηγητή Αλεσάνδρο Μαρόνι, ο οποίος θα μας μιλήσει για τους ευρωπαϊκούς κανονισμούς που αφορούν την υπερβαρική οξυγονοθεραπεία.
Wait a moment, please.
Okay.
Okay, you see you on the full screen.
Very good. I just see you at the moment.
Here is the audience.
Good morning, everybody. Nice to meet you, although from a distance. I am sorry that I cannot attend physically, but my good friends could not be left alone, and I could never dare to not accept the invitation to be present, at least virtually. So I beg your pardon for this, and I wish you the best of the courses, and I will do my best to give you all the information I can on the current status of hyperbaric medicine in Europe.
Okay, thank you, Sandro. So right now I'm putting your presentation on the screen.
Very good. Can I go?
Yes, you can go.
All right. Again, the scope of my presentation is to illustrate nothing really scientific. I will give you the administrative, educational, and current organizational background of how hyperbaric medicine is now organized in Europe, and I will start from some history and some physiopathological beginning. Next slide, please. As you may see from this graph, HBO is not considered a treatment to be done or administered alone. It should be considered a tool that should be useful to many disciplines in medicine, such as intensive care, general medicine, internal medicine, or surgery, whenever we are facing a vicious circle. Is the audio okay, Jacek? Just tell me if it is not good, okay?
Everything is fine, you can continue.
Okay. Whenever there is a situation where we are having, or the patient is suffering a vicious circle between hypoxia generating dysfunction, facilitating infection, and eventually ending up in injury. But you can enter this vicious circle from any of these 4 points, because each one will actually be prodromic and facilitating for the next one to come. And each one will further make the problem worse until it is corrected. But many times, the corrective factors is the lack of oxygen and the administration of oxygen. So the risk factor by lack of oxygen is where we can enter and break this vicious circle. Next slide. It's oxygen sometimes is really the tool that can help desperate situations like the poor donkey is suffering there. Next slide. This all started with the work of Professor Burema in Holland. And in 1959, he showed the first chamber, the first surgical hyperbaric chamber in the world, where he treated successfully many difficult situations, almost hopeless situation at that time.
Your surgical hyperbaric chamber was the first in the world. When was it built?
1959. Our technicians you see here are former divers from the Dutch Navy. These are the compressors for building up pressure. As heat is developed during compression, the air must be cooled. The pressure is building up now. The patient is inhaling pure oxygen.
Okay, next slide.
The next slide will show you the most famous experiment, which is published in Professor Boersma's publication named Life Without Blood. The video is self-explanatory, and so I think we should simply run it.
An experiment, in fact, shows that life without blood is possible under hyperbaric conditions. Pigs breathing pure oxygen at 3 eta are totally exsanguinated. The volume of fluid in the circulatory system is maintained. The absence of erythrocytes makes the pig look very pale, but the oxygen supply is adequate. After reinfusion with their own blood, the pig lived happily ever after.
Even if these papers and findings are almost 60 years old, they are... Hello?
An experiment, in fact, showed...
Sorry, I put the next slide already. You can continue.
Okay. Although these findings are 60 years old, they are absolutely current and modern, and they are actually the basis on which hyperbaric medicine poses its platform. Can we show the gas gangrene slide? Next.
Okay.
And now, Doctor, I think you would like to meet Dr.
Okay. Run it.
And now, Doctor, I think you would like to meet Dr. Brummelkamp, who can tell you about the Amsterdam treatment of anaerobic infections, particularly of gas gangrene.
The patient that's in the chamber now is dangerously ill from Clostridium infection. Clostridium welchii has been isolated from the wound. Formerly, progress of the disease could not have been prevented, but now hyperbaric oxygen is able to halt the spread of the infection completely. You have excellent results. What is the explanation? The Clostridium produces alpha toxin. When oxygen is given at 3 eta, the microorganisms will not die, but their production of toxin is stopped. You'll see that after 7 sessions in the hyperbaric chamber, over a period of 3 days, the process has been halted, and the temperature here has returned to normal.
And The next slide will show you another important thing, because clearly it is not all marvels.
Treatment of anaerobic
Jacek,
Yes.
can we go to the next?
Yes.
Okay. Before you run the video, the important thing to note is that Professor Burma was the first one to also prove in clinical practice the toxic effect that had been very well described and known in divers and in other circumstances by Paul Bert almost 100 years before. Can we run the video?
What do you consider the limitations of hyperbaric treatment, Professor Burma?
There is a certain risk of oxygen poisoning, I'm afraid. Hyperbaric oxygen can be given for a limited time only. After a latent period, and we must use that period in hyperbaric treatment, oxygen may act as a cell poison. And the damage is proportional to the oxygen tension and the duration of exposure. Acute damage to the central nervous system changes the electrical activity, and that causes diffuse electrical discharges, manifested by muscular twitching in the face or hands, or by generalized convulsions, as in this dog with attacks of epilepsy. Long and frequent exposures also damage the air-blood barrier.
At that time, this was the main toxic effect known, even if clearly knowledge was already there about the other toxic effects, such as the Lorraine-Smith effect on lungs, which were not proper of the acute use of oxygen therapy at that time, but made their appearance and became more important when hyperbaric oxygen became a routine system to be used. Now, 30 years after the opening, next slide, of the chamber in Amsterdam by Professor Burma, many of us, including myself, Dr. Kott, and others, and even Dr. Spiris Georgiou, so many of these founders, you have them in the room there, decided to found a scientific group, a committee called the European Committee for Hyperbaric Medicine, which had the scope to coordinate hyperbaric medicine throughout Europe. This is pretty important because Europe had, at that time, many countries, many scientific societies dealing with hyperbaric medicine, but lack of coordination and common standards. Therefore, we were only applying and abiding to the standards put together by the American Undersea and Hyperbaric Medical Society. Next slide. Therefore, we founded this European Committee for Hyperbaric Medicine with the scope to increase knowledge, improve quality, allow for better communication, improve research and new ideas, but essentially to standardize indications and protocols. In other words, to issue guidelines. And we did that, next slide, through the organization of periodical European consensus conferences on hyperbaric medicine. Now, there is a system that is defined as consensus conference. A consensus conference is a conference joining experts in the field which should present their knowledge in the specific field and submit it to evaluation by third parties. And these third parties are not necessarily experts in that special discipline, but must be expert in science, evidence-based medicine, related disciplines where, for example, hyperbaric oxygen becomes useful and so on. Therefore, we submit our recommendations to a process of peer reviewing, and this is the spirit of the European Consensus Conference. We ran many of these, next slide, and we started in 1994 in Lille, and now every 10 years we are running a general consensus conference on hyperbaric medicine. In 1996, we had 2 conferences, one on decompression illness and one on musculoskeletal trauma. Then, next slide, we had a conference on diabetic foot lesions and on fire safety in the hyperbaric chamber, and then on new indications for hyperbaric medicine in Malta in 2000, and then next slide in Lisbon on radio-induced lesions, in Geneva on prevention of dysbaric injury. Finally, 10 years after, we had the second European Consensus Conference on Hyperbaric Medicine in Lille, and then we continued in Ravenna, next slide, number 14, with wound healing problems and general critical care in Sharm el-Sheikh in 2007. Next slide. As I anticipated, a consensus conference system submits its results and conclusions to an international jury. And it is this